Hi, I'm Dr. Nataraj H.M. I'm an orthopedic surgeon with keen interest in treating shoulder diseases. Today in this video, I'm going to describe and educate you on shoulder dislocation. Before getting into the specific topic of shoulder dislocation, let's understand about the anatomy of the shoulder or the structure of the shoulder. Shoulder is made up of upper end of the arm bone, which joins with the outer end of the shoulder blade bone, forming a shoulder joint. The upper end of the arm bone is like a ball, and the outer end of shoulder blade bone is like a socket. The ball fits into the socket, forming the shoulder joint. And this socket is lined by a protective lining called as a labrum. The socket, what I described, is lined by a protective lining called a socket, which prevents the shoulder from dislocation or prevents the ball from going out of the socket. So this is the basic structure of the shoulder joint. Whenever there is an injury which pushes the ball of the shoulder joint out of the position, during dislocation it tears off the protective lining around the glenoid labrum and causes dislocation. When the shoulder dislocates, patient will be having severe pain and weakness in the shoulder, and there can be a visible bony bulge or a bump seen in the front of the shoulder and often in the back of the shoulder. When you visit your doctor, the doctor reduces the shoulder joint by a specific maneuver which causes less pain. And sometimes in a patient who can't tolerate the pain of reduction, in them it's done under a simple general anesthesia for a short time. It takes less than a minute. Once the shoulder joint is reduced, patient is put in a cuff and collar sling for a couple of weeks. Then the regular activity is encouraged, and patient is gradually put back to his regular sports and day-to-day activities. If the protective lining which is torn doesn't heal back into the right position, then there is a chance of repeated shoulder dislocation. This repeated shoulder dislocation happens either with a sports or sometimes even with a simple day-to-day activities, and in a worst case, it can even dislocate during sleep. In such cases, the protective lining which is torn has to put back into the position. So this can be done by a keyhole surgery or an arthroscopy, where the protective lining which is around the glenoid, which is displaced out, will be placed back into position and stitched back. This is a simple short surgery of around 45 minutes to 1 hour, and patient is placed in a cuff and collar sling for a few days, and then the shoulder movements are initiated. With this, the shoulder dislocation problem cures in 90 to 95% of the patients. In some unlucky patient who sought medical advice very late, that is after multiple dislocations they go to a doctor, in such cases, because of repeated dislocation, the glenoid bone wears off. There will be wear and tear of the glenoid bone, where the quantity of the glenoid bone will be very less. In such cases, doing an arthroscopy surgery might not help the patient and might not prevent the dislocations. In such cases, the worn off bone has to be built back. So this can be done by a simple open surgery called as Nataraj H.M procedure, which prevents the shoulder dislocation. Hope you understood about the shoulder dislocation. For more information, log on to my website www.kneeandshoulder.net. Thank you.